Okay, so last class we're talking about the drugs working on automatic nervous systems. We didn't finish, so we still go to this part. We start from review. We start from review. So drugs working on automatic nervous systems, like last time we talked about nervous systems, is separate with central nervous systems, CNS, and peripheral nervous systems, PNS. So in PNS part, some PNS working for the skeletal muscles. That part we call SNS. And some part working with the organs. That we call ANS. So when we're talking about drugs working on the ANS, we're just talking about the drugs working on this part. We didn't talking about other parts. Certainly later on we have a special class. We specially talking about the drugs working in the CNS later. But right now we're just talking about the drugs on ANS part. And for ANS, we still separate, we call sympathetic systems and parasympathetic systems. They both including in ANS part. So that's we just do some review for the nervous systems. We say nervous systems divided into CNS and PNS first. And on the PNS part, we separate somatic, that means control the skeletal muscles, and automatic nervous systems. So automatic nervous systems, also called vegetarian systems, because they're working automatically like some plants. So that's including the function of our circulation systems, respiration systems, digestion systems, and the maintenance of body temperature. You never worry about like your heart and your respiration and your digestion. You just eat it. They digest it itself. And the body temperature always maintenance in some range around 37 degrees centigrade. Yeah, certainly like morning time let it be low, afternoon let it be higher, and after exercises let it be higher, but generally around that range. And we say ANS divided or subdivided to sympathetic nerves and parasympathetic nerves. These two parts are truly working together. Generally say sympathetic is more excited, excited reaction. And parasympathetic is like inhibited reaction there, but not all follow that route. So when we go to special organs, we need to see special action in there. But truly they're working together. And both sympathetic and parasympathetic nerves, they will have ganglia. Yeah, ganglion. Ganglion, we learned it before, that's a group of the nerve cells. The location for sympathetic, they located very close to the vertebrae, very close to the spinal cord. It's outside vertebral column, but close there, pretty close there. They form a chain, yeah, both sides. And for parasympathetic, the ganglion is close to the organs, yeah, close to organs. So we separate from the ganglion there, the nerve branch before the ganglion. Before the ganglion, the nerve branch we call proganglion nerve branch. And the nerve branch after it, we call it postganglionic nerve branch. So that's generally we separate by ganglion. And the proganglion kind of nervous cells, the body, yeah, we say nervous cells generally say is a big body, yeah, big body, and the nuclear in there. And then they will have a pretty long axon. And then some small branches here connected with other cells. That's another cell body here. And thirdly, we have some dentries, small dentries around the body part. So we say the cell's body, yeah, the cell's body in the proganglion part, it will be located in CNS. We say CNS, including spinal cord and the brain. And then the axons, long time away, and then go to the last ganglion location, the cell's body, group of cells body. And then we say sympathetic, like they formed and they branched coming from thoracic area and the lumbar area, coming out from the spinal cord, just like this picture. Yeah, that's the T2 there and the L2 here. Yeah. They coming out directly from that level. And the parasympathetic nerves, they coming out from cranial nerves and the sacral nerves, means upper and lower. Yeah, upper and lower. Cranial nerves, if we still remember, we have 12 pair cranial nerves coming out, directly coming out from the brain. Yeah, directly coming out from the brain. But we only have 4 of them. Yeah, we only have 4 pair of them form our parasympathetic nerve sponge. The number 3, number 7, number 9, number 10. Others just control like the muscles, not truly go to the organ. So that's the upper part go to parasympathetic. And also we have coming from the lower part, yeah, coming from lower part, some bunch coming up and control some lower orifice and their functions. So that's basically pay attention to cranial nerves number 10 here. They always control like internal mainly organs in the chest and abdominal area mainly. And we say postganglion catenary branch will their axon, we're talking about their axon, still body there and the 30 long axon coming out, will directly go to affected organs. So that this picture, whatever parasympathetic, yeah, that's post-ganglion here, or sympathetic, that's that be long way, but still directly go to the organ. Then we're talking about the transmitter, neurotransmitters. Neurotransmitters, we're talking about some chemicals between one nervous cells and another nervous cells. Usually, generally speaking, between the first nervous cell, the ending part of the axon, and the second nervous cells may be the dendrites, like some small boundaries. And they will have some space. If the nervous signals transmission is basically on the same nervous cells, like from the body part transmission to the ending part, generally say that's electrical. But from one nervous cells to another nervous cells, we still possible some of them still transmitted directly by the electrical. But most of them, it transmit by the chemicals. So like they will have a space between these two nervous cells, and the electrical stimulations coming, and they will release some chemicals here. And on the second nervous cells, they will have receptors. They can directly receive the chemicals released from the first nervous cell. And then they producing some reactions, like muscles with contractions, and glands with secretions, heart will be beating. So that's generally. So the chemicals, generally say we have two very important chemicals. These two important chemicals, we call it neurotransmitters. So neurotransmitters just means they can send in information from the first nervous cell to second nervous cell. And these two important neurotransmitters, one is ACH, another one is NA, or you can call it NE. That's the same thing, same. Yeah. Just sometimes people call it NA, sometimes people call it NE, but they are the same. It's not three neurotransmitter here, only two. But the second one have two names here. So that's we're talking about the transmitter. In different nerve branch, they make difference. In somatic nervous systems, we say somatic nervous systems is control the skeletal muscles. They are not necessarily have ganglion. Yeah, you can see they don't have ganglion. The nervous branch directly go to the controlled muscle and control it. So this transmitter there is ACH. That's on the somatic nerves. Then we're talking about in automatically nervous systems. Automatically nervous systems, we say we have parasympathetic and sympathetic. They are different. They both have ganglion. They both have ganglion, like we see the picture. before. They both have ganglion. That's the ganglion. That means they have whole nerve sponge here, and also they have post nerve sponge here, like after ganglion. Yeah, after ganglion. And then they connect it with local tissues. So the transmitters in the parasympathetic nervous systems during the ganglion area means first nervous cell contact with second nervous cell is ACH. And also from second nervous cell touching with the organs, still ACH. Yeah, the organs form internal organs. Basically, it's smooth muscles or cardiac muscles. Cardiac muscles means heart muscles. And maybe some growth. So that's for the parasympathetic nervous system. For sympathetic nervous systems, little bit complicated. Yeah, little bit complicated. Compare with parasympathetic nervous system. In ganglion area, still the same. Yeah, in ganglion area, still the same. Still ACH. Yeah. Certainly, sometimes maybe different form kind of ACH. Chemical structure a little bit changing or a little bit different. So that's still, we still try to simply remember that's ACH there. Yeah, that's HH there. And then we're talking about go to the organs, including smooth muscles, the heart muscles, and some growth there. So basically, it's NE. Yeah, basically it's NE or NA, the same. That happens in the sympathetic nervous system. Sympathetic nervous system. But still have some except. Yes, still have some except. We say except the sweating glands and blood vessels to skeletal muscles. The transmitter there still ACI. So that's the transmitter and it located. We're talking about the transmitter and the location here because later on we will specially talking about some drugs. So means if the drugs working as ACH, they will trigger reactions both in the sympathetic nervous system and parasympathetic nervous system and sympathetic nervous systems, at least in the ganglion part. If we use some blockers, we block the receptors ACH, still they block these three systems here. And if we use some drugs, similar like NA or AE here, they only trigger sympathetic, like the ending part connected with organ part, organ function. And if we block, we only block here. So that's why we need understanding here. Then we will understanding the drugs actions later. Then we're talking about the receptor. So we say transmitter coming, special kind of transmitter, they need a special kind of receptors. I just make a picture similar like this, that they could directly holding there. And if some transmitters, like this shape, they need receptors like this. They need touching first, then cause the reaction. So one transmitter specially go to one receptor. So that means receptor. So receptors, we say that's 1-to-1 kind of matching there. Adrenaline kind of the response transmitter, they will with adrenaline kind of receptors. And certainly ACH, they have ACH receptor. But I just generally say here, but the receptors, they will subcategory. Yeah, they will have subcategory. So we say adrenaline kind of receptors, we including like NE, AONE. So that basically could got some receptor here. We can still separate some difference there, alpha and beta. Little bit different structures. So some drugs specially working for alpha receptor. Some drugs specially working for beta receptor. And we still have difference. We also have alpha 1, alpha 2, and for beta, we have beta 1, beta 2, even beta 3. In different organs, the receptor will be a little bit different. Thus, sometimes we specially pick up some drugs working specially type kind of receptors. We try not working like for all the organs. That will cause some side effects. Then we go to automatically nervous system drugs. We say generally say automatically nervous system drugs. They may be working, they may be working similar like transmitters. They have adrenaline. We say when we're talking about the antidepressants, we're still talking about adrenaline glands, about the kidney. In the medulla part, in the center part, we have adrenaline and noradrenaline. Noradrenaline, the same we're talking about the transmitter here. Adrenaline and noradrenaline, their actions pretty similar. Pretty similar. But adrenaline only coming from adrenal glands. Noradrenaline coming from adrenal glands and also working as a transmitter. But whatever they coming, the functions pretty similar. So that's why we use drugs. We're talking about some drugs, some drugs, they mainly working for parasympathetic systems. They like a kind of copy of adrenaline kind of chemical there and cause the similar effect here. And generally say cause the sympathetic nervous stimulation. So that's the one group of drugs. Yeah. They cause the excessive condition for sympathetic nervous. And we also have another small category here. That's category A, both working for sympathetic nervous systems because we say adrenaline only working for sympathetic nervous system. Then we use some other drugs we cause the inhibited functions. Basically, it's some blocker. Basically, some blocker sympathetic or adrenaline functioning. So that's the first category. We say adrenaline kind of drugs. If we go back picture here, we say adrenaline kind of receptors only in the sympathetic nervous. So that's why they only can working for sympathetic nervous. And another category we say they mainly working for parasympathetic nervous. Parasympathetic nervous, the transmitter, mainly ACH. So the chemical structures pretty similar like AGH. And the stimulations parasympathetic nervous sponge and got infection. And certainly you will be asked, they still some way working with sympathetic. Why we not call it sympathetic like the drug? Because even your stimulation here, but they are not directly working for the organs. They still need adrenaline working here. So that means ACH kind of drugs, when they working for sympathetic, because the transmitter on parasympathetic, that's the same here. Truly stimulation parasympathetic nervous functions. So we still one group of the drugs, they working like a stimulation, and cause the excessive condition of the parasympathetic nervous. And another group still inhibited, still kind of blocked and inhibited function in it. So that's about our automatically nervous systems drugs. Basically, which is working stimulation and blocker. Basically happens on the connected part of the like two nervous cells connected part in it. Then we talking about individual drugs here. So adrenaline are exactly the same. We talking about coming from adrenal glands medulla part. So the adrenaline is the drugs will be distributed in the digestive systems and also get metabolism in the liver. So thus we say we will not give it orally. So that's first part when we talk about pharmacology. Generally, we talk about two parts. One part is PK. PK, we talk about when drugs go to inside the body, how they can go inside the body, how they can be absorptions, and how they metabolize, how they finally release from inside the body. So that's we say the root go inside the body for adrenaline. Orally will not working because we have stomach, we have small intestine. Thus environments, we have a lot of digestion juice in there. Thus environments will broken down adrenaline and cause it not effective anymore. And even small amount is not be destroyed by the digestion system. The absorptions, then they go to the liver. They still be get some changing or metabolism in the liver. So that means we couldn't give adrenaline this kind of medication by orally. So then we need injections. Injection to the muscles, or maybe injection to just under the skin, that is under the skin. Connect the tissue there. Thus, generally say the absorptions let be slowly and gradually relieve to blood circulation. And then we can use it. So we are not usually injection to the blood vessels because they are pretty faster, go to pretty high degree in the blood circulation. They will directly working like for the heart, for blood pressure. That will be pretty dangerous kind of situation. Can cause the heart severe kind of issue. So these severe kind of issue, we know the heart bumping regularly and then they have rest time and then jumping again. So that time basically the blood circulation coming from the arteries to the ventricle and then coming from the ventricle to the blood vessel. They regularly jumping. But when the heart, we talking about the ventricle vibration there, means they are not regular like a push blood coming out. They just like a kind of small contractions and continually, it truly not pushing blood coming out. That means the body don't have enough blood to support oxygen. So that's very severe kind of situation, can cause people die. So we are not injection for adrenaline to the blood vessels directly. That's pretty dangerous. Adrenaline, we say we can injection to the muscles, injection can be under the skin, and we also can use like a local use for impaired patients. So that's basically we use if patient have asthma, and then directly we use this kind of drugs can cause the local blood vessels contractions and bronchi sterilize and get people like more oxygen going. And we say mostly metabolism happens in the liver and just a little amount relieved by the urine. Then we're talking about the PD. Yeah. PD is drugs working for the target cells. Yeah. So we say adrenaline deregulates stimulation, the adrenaline kind of receptors, and cause the infection. Thus, mainly in sympathetic nervous systems. So we say, depending the receptors, we say adrenaline receptors, we have alpha, we have beta. There is our receptor, receptor here. So we say we have alpha, we have beta. Alpha, we also have alpha 1, alpha 2. Beta, we have beta 1, beta 2, beta 3. So depending different receptors and their locations, the reaction is different. Alpha, basically, effect of alpha receptors is the blood vessels constructions in the skin and in the organs, and dilated the pupils, and also platelets go together like some bleeding kind of situation that the platelets are braided together. But otherwise, they will cause blood glucose. We're talking about this later. And the beta, beta receptors reactions. So basically, they're working increase the heart rate. And we're talking about decrease the periods, means the heart rate still means increase the heart rate. And dilate the muscles and coronary vessels in the heart. That's beta 2. And the bronchial relaxation, that's beta 2. Urinary relaxation, that's beta 2. And the increased blood sugar level and the increased fatty acid in the blood circulation. So that's generally different receptors, they will working for the different way. And the clinical indications, with the acute bronchial asthma, patient pretty hard, difficult breathing. That's the way directly because we have receptor there. And the allergy reactions, we can use this slide. And the locally bleeding, we can locally use because they contraction the blood vessels. And also with some local problems. In some severe kind of case, heart stop beating. We say generally we are not injection to the blood vessels, but for that emergency kind of situation, we truly need injection to the blood vessels. Adverse reactions. So adverse reactions, they may cause some like anxiety and chest pain and heart rate changing palpitations, blood vessels, blood pressure getting increased, and especially terminal area may be caused gangrene. So gangrene is the illness, losing terminal area, losing blood supply. Certainly, like some contraction in there, and also can cause some eye problems. and contraindication, coronary artery illness, severe kind of heart issue, and hypercarditis, and hypertension, and another medication we're talking about later. So basically, they're working for the heart. They are not used same time. That causes two stronger reactions. And we say they possible cause the terminal like ganglion. So we are not injection around the ending part of artery because they blocking the blood flowing to the local. So that's last time we talking about adrenaline. So no adrenaline pretty similar adrenaline and their actions. They still working for post adrenaline like nerve function there. So we say no adrenaline, both coming from adrenaline glands and also working for the transmitters, post ganglion adrenaline nerves. And pretty similar like adrenaline. Couldn't use orally. And we say adrenaline may be working stronger, even more stronger, cause the blood vessels contractions. So for no adrenaline, we even not give it subcutaneous or intermuscle. So it's pretty easy cause the locally cells dies. So that's usually is more dangerous compared with adrenaline. And the metabolism is similar, like adrenaline, still in the liver and still something released from the urine. So no adrenaline, we still like can cause some situations, like still working for the blood vessels. And we say the action is pretty similar like adrenaline. They still can increase the blood pressure. We use the hypertension, that is low blood pressure. We increase the blood pressure. And the side effects, still pretty similar. Anxiety, headache, that's pretty common, and cause blood pressure pretty high. And we say we are not injections basically to the local because they may be cause the necrosis, means the cell dies. So that's some side effect here. So look like adrenaline and no adrenaline is pretty effective, but at the same time, this causes lots of problems, side effects. Then clinically, we can use another medications. So these are even more commonly used compared with adrenaline and no adrenaline. And we can see these one truly can absorb it from the digestive system. And we also can use for injections. They still metabolism in the liver. And also something released by the urine. So these one basically clinically more commonly used compared with adrenaline and no adrenaline, and more safety to use. So it have the similar actions, stimulation both alpha and beta receptors. when we talking about some, the functions alpha and beta receptors, I think the next semester we will go to there. We will specially talk about what action, but generally we say it's like make heart rate, increase heart beating stronger. And so that's basically similar like noradrenaline and adrenaline. So they also can cause the CNS stimulation. We will talk about CNS drugs. So CNS drugs, they still have transmitters. Some transmitters still similar like adrenaline and noradrenaline. So they still cause the same actions. So that's for this medication. And the clinical use, we can see a lot of aspects. Asthma, we still can use asthma. And we even can use for preventing. It's not only used for asthma attacking. We even can use asthma attacking. And some people always like have those problems. So the scientists like information happens in the sinus area or rhinitis means nose infection. They cause nose blocking. So we can use this one locally, dialite. And working for the eyes, dialite pupils, can especially working for some like eye specialists. When they try to see what inside the eyes, they need to dilate the pupils. And we can working for heart issue. And we also can treat some people like a white light in the nighttime, like children pretty easily got these problems because that's still controlled by the smooth muscles. They still have receptor there. And the side functions, still similar, like adrenaline, still similar, but not that severe kind of reaction there. And also some other reactions with the possible constipation, insomnia, difficult fell asleep, so excited, internal organs. And the possible cause the retention of the urine. We say we can treat the patient in urethritis, means they holding the urine there. Certainly, if a patient don't have that problems, that's truly cause the problem holding the urine. So any drugs, they have bad effect, they will have good effect. They have good effect, they will have bad effect. Contraindication, contraindication. Still similar like adrenaline. So basically, chemical structures, they are pretty similar, just a little bit different. Just a little bit different. So we still need to be careful to use these drugs, but truly, clinically, is more commonly used, compared with adrenaline more. Then we're talking about the blocker, adrenaline blocker. We say the ANS drugs, we separate with two big categories. One category belongs to adrenaline kind of drugs. Another category belongs to ACH kind of drugs. Adrenaline kind of drugs, we have drugs. We do the same thing like adrenaline, even adrenaline itself. Same thing. Means stimulation actions. Others we use for blocker. Blocker means blocking the function. Now we are in the blocker part. So blockers, we can block alpha receptor, we can block beta receptor. So if we block alpha receptor, means just the alpha receptor function be blocked, inhibited. If we block a beta receptor, only beta receptors function be blocked. So we can separate to block. That means we can avoid some side effects. We only try to block one, not only two. So alpha blockers, we say we're working specially for alpha receptors. So generally, the actions lower peripheral blood vessels receptors. That means basically blood vessels is holding pretty tight and holding the blood vessel there. They keep the blood pressure. When they less holding, kind of similar like a blood vessel dilate. So certainly they will decrease the blood pressure. So constant reactions, people may be hypertension, especially they just moving like from lay down there to sitting there, or maybe just from standing up suddenly and cause the temporary whole hypertension. Yeah, hypertension means low blood pressure. And because the hypertension there and not enough oxygen sending all over the body, so the heart try to beating faster, cause the heart rate increase. That's the reflection kind of heart rate increase. So that's when we use this category of the drugs, we need to be careful, tell the patient, don't get up suddenly. Some others infections, including the pupils getting smaller and nose stiffness, just the opposite to adrenaline action. Yeah, you can just think about opposite to adrenaline action. So that's one of the alpha blocker, alpha receptors blocker. Yeah. So similar we talking about before, they especially blocker for alpha 1 and also blocker to alpha 2, but not that effective like alpha 1. So mainly blocker for alpha 1. So relax artery and smooth muscles because it's broken there. So still low blood pressure. And when blood pressure reducing, so blood return back to the heart will be decreased, and heart output will be decreased. And they also can relax like your bladder. Clinically, truly we can use this one treat for hypertension. And we also can treat another illness we call Raynaud syndrome. That's just the doctor's name here, nothing special. But the problem, the syndrome is the blood vessels, arteries, pretty narrow and tight there, and even some blocking there. So they are in the terminals, usually in the hand and the feet. So that cause problems like not enough go to locally. No enough blood go to locally, no enough oxygen go to locally. from the beginning, the patient maybe just pale color on the hand and the feet. Later on, because their blood blocking there can cause the patient painful, and finally can cause the gangrene. So we need to dilate the blood vessels and get more blood supply to them. Then we're talking about the beta adrenaline kind of blocker kind of drugs. We have a lot of drugs in this category. So they specially block beta receptors. So that's mainly working for the heart. Beta 1, especially in the heart, and also for the blood vessel. So that's pretty commonly the medication we use, beta adrenaline receptor blockers. So these drugs we can use orally. And in the liver, there's still metabolism in the liver, but still leaving 1/3 can go to blood circulation. You can work in there. You can work in there. So that means basically, if we try to go a little bit higher in the blood circulation, which is taking a little bit more dosage there. And they release mainly in the urine. And then we talking about the PD. So the actions, they go to blood systems. Remember, we are talking about beta blocker here. Beta blocker here means blocking some function. So decrease the heart rate. Just the opposite for actions, for adrenaline actions. Opposite. Reducing heart rate and reducing the heart muscles contractions force and reducing the heart pressure and cause the respiration symptoms contractions, bronchi contraction, and decreased blood sugar level. And for CNS, they can anti-anxiety. So just the opposite for adrenaline kind of drugs. Just the opposite. And they also can working for the eye. And for the kidney, decrease the secretion of the kidney. So that's the mainly actions. Mainly actions. Indication means clinical use. Indication means clinical use. Can treat heart issue, especially some irregular heart rate. Can treat hypertension, high blood pressure. Can preventing or against angina. Angina we will especially talk about later. Basically because blood vessels narrow there and blocking the blood flow to the heart muscles. So we dilate coronary artery, we sending more blood to the local. That's why we can treat angina. And the same thing. That means something truly totally blocking there. We still dilate blood vessel in the coronary artery. And thread gland problems cause very severe kind of situations, like metabolism pretty high, heart jumps pretty high, blood pressure pretty high, pretty dangerous situations, and some anxiety. and also some headache, migraine headache, and decreased pressure in the eyes also. The glaucoma is caused by the pressure inside the eyes increase. So we can decrease air pressure inside the eyes. Looks pretty good, but it still has some adverse reactions. So it possible cause some reaction in the stomach, like nausea, vomiting, and possible cause heart failure. We say we try to like heart beat a little bit slow, but maybe truly not working. Heart block similar, and hypertension. We say we treat hypertension, but maybe cause hypertension. Hypertension here, pretty similar words. Hyper means high blood pressure. Hyper means low blood pressure. And maybe pretty severe heart rate decrease. And cause the bronchospasm. Patient will be short breath like asthma or puffing. And some allergy reactions. And some vivid dreams, still sleep problem. And nightmares. And cold hand, because blood supplies. And also pay attention here, withdrawal syndrome. What means withdrawal syndrome? Means people take a long term, they feel better, but if we suddenly stop to take it, all the symptoms coming back and even worse. So if we try to reduce, we gradually reduce, don't stop suddenly. And also, if some people have diabetes, and these truly, like diabetes kind of patient, they will injection insulin, but if they use too big a dosage insulin, they will be decreased blood sugar. Usually patient will feel it, but if we use the blockers, people will not feel it. Even the blood sugar pretty low, they still feel normal. So that's still side infections. And contraindication and precaution. So people have asthma, we couldn't use it because we talked about before, they cause the bronchial contractions. And the diabetes patient, we just talking about if you use this medication, if the blood sugars level is dripping down, people couldn't feel it and causes severe kind of situation. Heart failure, that's side infection, it can cause. If patient have heart failure already, we couldn't use. And we couldn't use for some blood vessel, peripheral blood vessel, some still because they block it. So that's